Behind Vijay, can you go for next presentation, please? We will connect back.
No worries. Okay. Next up, we have Dr. Venkata Nagireddi, who is a pediatrician in Fetus USA. He's a board certified in pediatrics in Britain, a member of the Royal College of Physicians, MRCP London, and he has worked in pediatrics for 6 years in the UK. He'll be presenting on thrombosis in the pediatric population. I'm now handing over the mic to you.
Can you hear me?
Yes.
Good morning, everyone. Good afternoon and good evening to all my colleagues, friends in India and US. My name is Dr. Venkata S. Nagireddi, and I'm a pediatrician. Been practicing pediatrics last 15 years. I'm in a private practice. Well, you know, a lot of my colleagues, they spoke really well, and I'm going to be really brief. I'm going to speaking about mainly the reasons of why this pediatrics, in the pediatric population, and mainly regarding this thromboembolism. Thromboembolism, it's not that common when compared to adults in pediatric population. In the pediatric population, mainly infants, I would say, premature babies and probably less than 1 year of the babies are more affected than compared to pediatric population. So the babies are born, especially at premature. We use catheters like central catheters. Sometimes we use a venous access like through the umbilical artery and umbilical venous catheter, or sometimes umbilical arterial catheter, or sometimes we have to access through the femoral artery. Those are the main reasons that, risk factors for mainly thrombosis. The reason we use this access is mainly for hydration, medication. Of course, in case of ICU, setup, we need to, monitor their mean blood pressure and all these issues. Also, babies, when they have issues with infection, sepsis, DIC, disseminated intravascular coagulation, and they're more prone for these thrombolism. And also, when the babies, they have congenital heart disease, and especially with any mechanical valves, or if you're trying to, do CATs through the femoral artery, especially at, checking the pressures or giving some, radioactive opaque agents and all the stuff, then in such case, it becomes a huge risk factor for these thrombotic episodes. Comes to, pediatric population, pediatric population is slightly different when compared to the babies. Of course, if they have any issues with their blood, previously as you guys spoke regarding, any issues with the blood, like, antiphospholipid syndromes, protein C deficiency, S deficiency, and all the stuff, they're more prone for these thrombotic episodes. Or if they have any issues with heart, or if they're having actually mechanical valves, or if they're getting any CATs. Similarly, if they're having any issues, mainly like dehydration or infection or any surgery, major surgery, or prolonged immobilization, those kind of things are the major risk factors. Sometimes these kids, especially teenage kids, come to our office, request for oral contraceptive pills and all these things. Oral contraceptive pills, especially estrogen, pills. If they have any issues with any blood, like factor V Leiden deficiency or factor CS, any problems. So if you're prescribing these medications, it's a huge risk factor, thrombotic episodes. So we have to be really careful. And if they have any congenital heart disease, like if they have any issues with atrial fibrillation or cardiomyopathy, actually they're also more prone for these thrombotic episodes. And sometimes kids with malignancy, and especially with ALL, acute lymphatic leukemia, and they're more prone for these thrombotic episodes. And usually these kids with malignancy, sometimes they require long-term chemotherapy. They have the central venous catheters. And when they have these central venous catheters, I think they are more prone for these thrombotic episodes. Similarly, some chemotherapeutic agents like L-asparginase and these kind of medications can give you trouble. So having said that, as I told that, these thrombotic episodes, thromboembolisms, they're less common in the pediatric population when compared to adults. And when it comes to signs and symptoms, we have to be very careful. Sometimes these signs and symptoms can be really subtle. Or sometimes it's not really pointing towards a cause. Like sometimes they can be really irritable, and they can suddenly have a seizure. Or sometimes you can see a little bit of discoloration of the limb, especially if they have a DVT. And of course, they can have issues with heart and lungs, tachycardia, tachypnea means breathing fast, heart rate can be high. Those kind of symptoms that you can see in the pediatric population. During this COVID, as you noticed, I have seen a lot of kids with COVID, and I've diagnosed with kids with COVID. And what happens is a lot of the times, they have the high fevers, 5-6 days of fevers. There can be, some changes in the blood, but most of the time they're okay. But some kids can get affected. All the systems can get affected, multi-system involvement, especially if it is affecting the heart. They can have issues, especially at, ventricle, left ventricle, and all these things. They can have thrombotic episodes. And also it can affect that, blood, hypercoagulable states, and they can have venous thromboembolisms. So when kids are having these kind of signs and symptoms, we have to be careful. We have to be broadly thinking at, is it because of thromboembolism? Is it because of the infection? Is it head injury? As a meningitis, sepsis, or as any congenital heart disease? We need to take into everything consideration, do appropriate testing, and treat them. So this is my brief discussion about the thrombotic episodes in the pediatric population. And all of my colleagues, they have actually given excellent presentations. And with this, I conclude my presentation. And I thank you, Dr. Kumar Garu, for arranging all these things. Every year we have in our office, I invite all my colleagues and friends and kids, and explain about this thromboembolism, usually every year. But unfortunately this year, because of the COVID, we are not going to meet. And this is a virtual thing happening. And I thank everyone. Thank you. Thank you for the opportunity.
Thanks so much, Dr. Nagireddi garu. You have done an excellent presentation, Andy. So we are all glad to share, Dr. Nagireddi garu is treating a lot of pediatric patients in Festus. It's a suburb of St. Louis. Since it's, since March, especially, and he's in the front line. So thank you so much, Nagireddi garu.
Thank you.
Niha and Vicha, please go ahead.
Thank you. So next up, we have Dr. Kumar Kuthapalli, who is an associate professor of pediatrics at Dell Medical School, UT Austin. He is well known for his work on Odonum kidney disease and his